Another class of drugs commonly used to treat myeloma today are the proteasome inhibitors. This started with bortezomib or Velcade about a decade ago. These drugs, in fact, make other drugs to treat myeloma much better. We call these drugs chemosensitizers. They make the other drugs look just that much better, like the chemotherapy drugs, like the steroids. We know they as well directly kill myeloma. They also make myeloma cells unable to grow as well. They have a multitude of different ways in which they accomplish these goals. But basically, they inhibit a system in our cells that's the garbage can of the cell. And when the garbage can is closed, toxic proteins accumulate, and those proteins allow myeloma to die. The good news is that myeloma cells are much more sensitive to this impact than other cells in the body. These drugs have been used first to treat late-stage myeloma and today often as frontline treatment for myeloma. Their activity is much better as they are combined with steroids, with chemotherapy, and the immunomodulatory agents. Today, it is uncommon that they are used alone. The drugs can cause side effects. Specifically, most commonly, they can cause neuropathy, numbness, tingling, burning pains in hands and feet, and sometimes weakness in the legs and the arms. These effects can be reduced if the drugs are given at lower doses, on longer cycles, and if the drug is given subcutaneously. These three things result in much less neuropathy and patients staying on drugs. And we've learned, particularly when the drugs are combined, these lower doses and longer cycles can be very effective. The drugs can cause shingles, so we recommend that patients be treated with antiviral drugs like acyclovir or Valtrex or Famvir if they're treated with Velcade. The drugs can also lead to reductions in blood counts, so we watch those as well when patients are on this treatment. These are highly effective drugs and have certainly improved the quality and the length of myeloma patients' lives today. The newer kid on the block, approved about a year ago in 2012, is a drug called carfilzomib or Kyprolis. This drug too is quite effective to treat myeloma, and in the same class as Velcade, has similar mechanisms of action, but can also, it turns out, overcome resistance to Velcade. It therefore adds to us a great option for patients who fail Velcade, as well as, it turns out, other immunomodulatory agents. It causes less neuropathy than does Velcade, and therefore is a good option for patients who have Velcade-induced neuropathy. Like Velcade, it is much more effective when combined with steroids, chemotherapy, or the immunomodulatory agents such as thalidomide, Revlimid, or Pomalyst.